Hello, and welcome to Sky Career Talks, where we connect students with professionals sharing their real-world experiences and career journeys. I'm your host, Tallulah Pentecost, and today I'm very excited to be joined by Amanpreet Kaur. Aman graduated from Rutgers in 2015 with her Master of Information and has gone on to work in health librarianship in various capacities. She has previously worked as a health literacy librarian at the University of Pennsylvania's Leon Levy Dental Medicine Library, and she's currently pursuing her Master's of Public Health from the University of Pennsylvania, where her scholarship focuses on bridging libraries, literacy, and healthcare on the community level. Aman, thank you so much for taking the time to be here today and talk with me.
Thank you for having me.
Yeah, super excited to get to hear about your journey. Um, I think first we could just start with a brief overview of your career journey and what that has looked like for you.
Yeah. So interestingly enough, I've been reflecting on my library journey, and I had been volunteering in libraries since like elementary school. So school and public libraries were my intro to libraries. And then I didn't never thought about librarianship as a career. In college, I would use libraries as the place of like studying, taking naps, like meeting other needs, but I never thought about it as a career option. And then so in college, I pursued my bachelor's in family and consumer sciences education with a minor in engineering studies, and I thought that I'd be teaching health and nutrition, human development classes in like a middle school, high school setting, um, advising an after school robotics club. And I thought that was like my life. And then while I was waiting for my teaching licenses to get approved, I joined the AmeriCorps, and I ended up developing adult literacy services at a public library. And this experience like reintroduced me to libraries in a new way. And I started to see like, oh, it's a career option. Like there are librarians around me in different capacities, and I really enjoyed teaching adult English and GED classes. I was planning events, I was coordinating a tutoring program. And after I completed my AmeriCorps service year, I became a grad student at Rutgers and was exposed to many types of libraries, public, school, academic, medical, special, business, and in part for with like talks like this, or through coursework, or internships and job shadows, um, and I was very fortunate that after I had graduated, I participated in a 2-year like postmaster's residency. So it was a entry-level librarian position with a built-in like mentoring component. And this residency focused in science librarianship and in academic science librarianship. And then after my residency, I continued to work at Penn as a community health and engineering librarian, and then most recently as the health literacy librarian. So I continued to the science library like residency introduced me to like two paths, health sciences and engineering. And that's based on also like my previous like undergraduate experience, subject areas I was um, enjoying as a student, and then I got to practice librarianship and like develop my skills in that. And then um, and then I got to continue exploring health literacy as well. And this also like connected me back to adult literacy, like from the AmeriCorps experience, um, and throughout my academic, um, library career. I also continued to like collaborate with public libraries as well. So I kept my grounding in public librarianship as well, even though I never practiced as a librarian in public libraries. Um, and then um, one of the really cool things about working at a university is that um, there's an employee tuition benefit, and I took advantage of that. And I dabbled in auditing classes. I was exploring computer science, world languages, cinema studies, education law, and kind of like I guess we're librarians are nerds. We continue to learn and grow, and this is my way of also like continuing um, to learn about the world around me, take classes that I otherwise wouldn't have had the opportunity through my previous degrees. And I began taking public health coursework, and I enjoyed it so much that I decided to enroll in the degree. And the MPH program confirmed basically what I had sensed as in my librarian career of like how important literacy is. But through it, I learned that literacy is the top social determinant of health outcomes. Um, and I think that my public health coursework also was timed with like the return to normal or the new normal from the pandemic as well. And so it was fascinating to like to learn about the theories and frameworks of like how people make these decisions and what types of information influence people. Um, and then also like to understand like how the declining rates of literacy and reading are a public health crisis. And like as a librarian, I want a piece of that, a piece of the say in how people describe these things because I am the librarian in my classes. I'm surrounded by students that are studying public health. Maybe they studied it from undergrad, or some of them are working clinicians. Some of them are dual degree students. So it's like we're coming from different angles, but it's like I have the information science perspective to bring to the table. Um, and it's been interesting to explore. Um, so I found different ways to explore like librarianship and literacy through my coursework. And
Yeah, that's a wonderful journey, and that's so inspiring that you've done so many different things in your career
yeah,
journey. Um, and yeah, and I think I know you're sort of currently transitioning out of academic librarianship,
yeah.
but I wonder if you could speak a little bit to what some of the skills are that you think have been most important for you in that part of your career.
Yes. And so I think the like I, what I really enjoyed about academic librarianship was like the tech savviness of it. So I'm still using, all of my research skills that I've learned, the database searching, and all of these things are going to translate into public health as well. But it's helping people, and I loved like being a librarian first because I didn't come in with like my own research agenda. I know many people in academia already like are in the know of like what they want to study and stuff, and I really enjoyed doing other people's research, and I got to learn about different problems, different complex issues around the world. Um, by answering the most random questions and through the years, and I think that helped shape how I think about like my own research interests now that I have them as well. I think that um, there's different ways of interacting with a librarian. So it's like I remember like chat shifts. I was the librarian on duty. People would call, and sometimes you anticipate when you're a subject librarian, like what subjects you might encounter, but when you're just the librarian on chat during that shift, it could be any question. So just being able to like connect people to resources, and I think that that was a real joy, interacting with students and faculty. Like I really also enjoy like instructional design, and web design. I had explored some like user testing as well. And I think those also, you know, play a role in how we interact with information. And then as far as like workshops, I had this like um, workshop that I had kind of revised over the years. I had collaboratively like developed it with a nursing librarian colleague and over the years kind of like changed it based on my own experiences in um, as a patient, navigating like health situations, but also like my own understanding of like health literacy, and interacting with people who are clinicians. So it was like this like how to evaluate health websites and apps. And it's much more complex than I think what we learn about through different information literacy like tests. There's different mnemonic devices, and I think it's, how do you develop a sense of like what is authoritative information? Who's allowed, to be considered an authority? Are what biases are in play, and like which ones are acceptable in a certain context? Which ones, make us like ponder like, oh, I wonder if there's other websites, and like these skill sets with information literacy super useful across the board. It's not just in healthcare, right? Like we come across information, in all sorts of ways. So it's like in social media, in through the news, through our friends and family when they bring up some topic, or have questions, right? So it's like it's really interesting to think about it, from the side of like, you know, being a librarian who does reference, but then it's like, these techniques, they're useful in so many ways as well.
Yeah, yeah, I think that's really, really true and sort of something I'm realizing in my education as well. Obviously, I don't not working yet, but
Mhm.
yeah, I think the skills that we learn in librarianship are useful in so many different ways and you can carry them to different aspects of your career. Um, and I think you've already talked a little bit about it, but I was going to ask sort of what your favorite thing was about being an academic librarian, if you have a favorite thing.
So I think for me, I enjoyed information literacy instruction, and developing like really interactive lesson plans. And I know different academic librarians have different ways of going about that, because there's so many different types of like um, ways of teaching and learning, and um, and you might hear about like the one-shot instruction experience where you have 10 minutes, to make a pitch, or less, depending on, what the faculty member allows. And other times, a faculty member is like, you're the guest speaker for 3 hours, like develop something that's, you know, on the day that I'm not going to be around.
Right.
Like the lighting's going to be here and you can do whatever you wish, like share, like, uh, get get these students to practice using a database, or you can assign them homework, or pre-work or something. And it's very creative, and I've enjoyed that. Um, and and I would do this like in undergraduate, graduate classes, but there's also a lot of K through 12 programs that visit universities. So like, in the summertime, it might have been like, there's all these like visiting students that, maybe they're doing some sort of enrichment program, or maybe they're, taking some college classes just at a younger age, um, and it was just kind of I think they were the ones that were like most willing to learn, because I guess when you have like a shorter time frame to like use a database, you're gonna take your time to like, want to use it and explore it. Whereas like um, if you're around campus for 4 to 6 years, you have a little bit of time to learn about these resources, and then it's not until you're like a senior thesis, where you're like, oh crap, I need to learn, how to do this research. I'm about to graduate, and so I think it's just kind of interesting in that way. But yeah, like teaching is a pretty cool experience. And one of the things that I valued about libraries, like, so I mentioned that I thought I would end up in like a middle school, high school like setting originally. That's how I had envisioned my career. And even public libraries like have this don't have like a formal curriculum, but like people go in with questions that are, they want to know. And I think that's like the same thing with many academic um, interactions as well, where there are students that learn outside of class. So and maybe it's not, you know, the their course assignment that's motivating them, but maybe they have an entrepreneurial idea, or through their student club, they have a question, and they want to explore that. And it's the just in case, just in time, you know, kind of like interaction. Libraries can support curriculum, but then they can also support all those other questions that are not curricular. Because people have a love for learning, or they have questions on their mind. Um,
Yeah, yeah. I think um that's I love the sort of educational aspect of librarianship as well. And I think that a lot of people probably agree, and it's something that's very rewarding in a lot of ways. Um, and I do want to obviously shine light on your recent career move, and I know you've already talked a little bit about it, but do you think you could explain a little bit more about, why are you getting your master's of public health now? What do you foresee doing with it in the future? How did librarianship bring you there? Any of that?
yeah. So for me, I was really intrigued by this notion of health-related misinformation, and it had been going on for a while. And I think a lot of people associate it with COVID, but there's vaccine hesitancy and misinformation that was going on for a very long time, and in a wide variety of health topics, wide variety of science topics, and part of it's just like how science gets communicated, how it ends up getting represented. Uh, the examples I can come up with would be like, um, coffee is good for you, coffee is bad for you, and these things just get translated from research that's going on. And what do we do as consumers? Do we look at that and like take that into consideration? Are we ignoring it? You know, and there's a lot of different factors that go into it. So when I originally applied for the MPH, I was thinking, oh, I'm a librarian. I'm gonna tackle, health related misinformation. And it's a complex beast. And but then I ended up doing other types of like projects as well. So most recently I completed my capstone project with the Children's Hospital of Philadelphia Literacy Lab, and I learned about um, the skill of program evaluation. So like how do you know, compare effectiveness or measure like areas of improvement, or like successes in an intervention. And the program that I was evaluating with my colleagues is called Reach Out and Read, and it's a national evidence-based early literacy intervention geared towards children ages 6 months to 5 years old. And in the greater Philadelphia metro area, there's over 80 clinics that implement this program. And it was really interesting to learn about program evaluation because I feel like in libraries, we're so shy about collecting data and and part of it's because like privacy is ingrained in our profession. And it might be harder for us to like prove the effectiveness of library and literacy programs because we're so shy about it. So like, there is an assessment movement in the library world. We see some of it, and over my librarian career, I've seen more of it as well. That's like coming up, but it's really interesting to like think about it from the public health standpoint of, you know, they need to make sure that this program works, right? Like in order for clinics to justify, implementing the initiative and to get more funding for early literacy you know, as well. And part of it's like, you know, school readiness and these early literacy skills are so foundational to the rest of our lives. Learning the alphabet, learning how to interact with books, that changes a child's trajectory. It opens the doors for education, economic opportunities, and you know, it sets us up for the rest of our lives. And I never thought about it from the health standpoint of like, but again, it's literacy is a top determinant of health. And, so I think there might be, you uh, the way of like using public health and wellness research to promote literacy, especially at our young ages. And then the other like really cool um, project that I've been working on is for my applied practical experience. It's also called field work. I've been collaborating with the We Need Books Library in Athens, Greece. This library is Greece's only multilingual library. It functions very similarly to like a neighborhood library, but it's entirely like funded by private donations. And this library um, is interested in learning how to best meet its community's health and wellness information needs. It's a very multilingual, multicultural neighborhood. People from different socioeconomic backgrounds are living in this neighborhood, and um, it's been interesting to explore mixed methods research. For me, I've learned the skills of like interviewing library staff, community leaders, people who use the library. So I started with a literature review that helped me develop the questions in conjunction with the library staff. And then we did some mix of like WhatsApp, virtual video calls, and then we also did a survey that was available online, but also as a written survey. And then I spent some time in Greece over the summer to do in-person observations and interview people, um, and visit some other like libraries that are government funded, and also like other types of community spaces that exist. I'm currently in the data analysis phase, so it's been interesting to like see what themes arise, what ideas people have, what is actually practical, and um, just thinking about it. In some ways, it's like I'm it's kind of a full circle moment for me where it's like it's kind of reminding me of my AmeriCorps experience a little bit, thinking about like what it means to like develop programs from the ground up. But then it's also like when you're there on site, you can see, like the you get the feel for like is it accessible? Can people walk there? What's close by? Are there green spaces? What kind of businesses are right next door? And it's been interesting to think about it um, and and then going back to like the tech savviness of like academic librarians. So I've also been able to explore qualitative data analysis software. I purposely like chose something that was open source. That way it's a little bit more accessible when it comes to like data formats and stuff because this data belongs to the library, the community, the stakeholders, and um, seeing what libraries around the world do in this area has also been really interesting. Um, and and going back to like just research skills in general, I was very nervous going back to school, and but especially around like you know what if like people don't want to be my group partner? Maybe my schedule's a little bit more complex. And it turns out like my classmates actually appreciate my research skills because um, yeah, I know how to put together the search strategy. I know the citation management tools, and we can quickly do the literature review part. And some of our sometimes in public health or in health communications, literature reviews are called like desk reviews. So it's like this is the stuff that you do before you do the mixed methods qualitative research because you need to, become, you know, familiar with the topic before you can go out and like, ask people what they think about that topic. So it all feeds in.
Yeah. Yeah, both of those projects sound amazing, and I wish you luck with the data analysis. Um, and it's really great to hear that like librarianship doesn't have to be the final step in your journey, and like the MI program can lead you to different areas
Yes.
that maybe you weren't expecting. And in that same vein, before we finish, I would just love if you could, if you have any advice for current Rutgers students who are in the MI program or anybody wishing to get into health librarianship. And I'm so sorry, but Rutgers only gives us a 40-minute Zoom license. So the
Oh,
meeting is going to end in about 7 minutes. But I
okay.
just want to put that on your radar.
Yeah, no worries. Yeah, so like another thing I wanted to emphasize, like one thing that I've learned about like consumer health information as a librarian, you know, the idea of like needing to pay extra attention to like readability and like how information, was designed. So it's like being able to see examples out there and like if they are not under like copyright licenses, like those could become the examples that we can adjust for like reading level. So thinking about like government publications, right? Like they're not under some copyright license, but like maybe they're the inspiration. Oftentimes like they don't have like the visuals, but they might have the language about oral cancer screenings or something. And then you know, being able to like find examples like that. But one of the you know, my biggest piece of advice, and I don't really like giving advice to people because it's like everyone has their own journey. But one thing that has been useful to me is to just be open to the possibilities. So I graduated from Rutgers 10 years ago, and I had no idea that, I would end up like working, uh, you know, in certain spaces, in certain job titles. I was just kind of like being open-minded to dabbling in academic librarianship. I did a 2-year residency. I didn't know that it was going to um, lead to other types of like job titles. The job titles that I mentioned earlier, it's like I didn't know that they existed. And I didn't know that working in libraries would seamlessly lead to this other, degree and thinking about how like uh, intertwined literacy and health are. I think that's uh, uh, it's going to be really important, to think about well into the future. But it's also like uh, how much of my life, was impacted by the pandemic and like other things around me that I became curious about. I had no research agenda, like I said earlier. I was just kind of open to the possibility, and it led me to have my own questions to ask and explore. And it's I'm really looking forward to like seeing how it like plays out. And I think that, and keeping flexible as well of like, does this mean, another opportunity in academia? Does this mean healthcare? Does this mean, nonprofit work? I'm kind of open-minded to that. And yeah, so it's pretty exciting. Thank you for yeah, asking these questions
Yeah,
and being
yeah.
interested. And people are happy. Yeah, you can reach out to me as well. I think my email is listed in the Sky directory.
Yes,
Um,
yeah. Yes, thank you so much for this. It's been wonderful to hear more about your journey, and I'm sure it'll be very helpful to people who are interested in health librarianship, academic librarianship, anything beyond that. It's a great resource. So
yeah,
thank you
yeah.
so much.
Thank you so much.